Hello, and welcome back to Ask Your Pain Doc. In this channel, as you know, we talk about traditional and alternative treatments for pain. I've been away for a while. I was busy with work and family and life, but I'm back with more videos, with more interesting topics and cool stuff to talk about. Today, we're going to talk about oxycodone and Oxycontin and what's the difference between them. And I have a lot of information about these medication. Let's do it. Welcome back. Let's watch it. Oxycodone is a very strong pain medication, and it belongs to the group of medication that they call opioid or narcotic pain medications. It works by interacting with the brain and nervous system to reduce the perception of the pain. There is a slight difference between narcotic and opioid. Narcotic is a legal term that they use it in courts, drug enforcement agencies using that, and you have narcotic unit, but opioid is that group of medication that we're referring to. An oxycodone, morphine, hydromorphone, or dilaudid, they all belong to that group of medications. Oxycodone is a semi-synthetic drug. That means that you don't find it in nature like morphine. They usually get morphine from the puppies or poppy seeds, but oxycodone is a synthetic medication. It's very close to its family member, including morphine and codeine. Oxycodone comes in a different form and formulation. The first one is the immediate release, or the oxycodone that the physician prescribed for immediate release pain. It's a very rapidly acting medication. 2, it can come in a form of liquid and oral solution for patients who are unable to swallow the medication. We can also have it mixed with other medication. For example, Percocet is a mix of oxycodone and Tylenol. Oxycodone works by binding specifically to oxycodone, or what we call it, the mu receptors. It binds in the brain and the spinal cord, and it will change the way our body perceives the pain. When oxycodone binds to this receptor, there is a change in the transmission of the nerve stimuli or the pain stimuli that feel to the brain. But oxycodone also attaches to other receptors in our brain and spinal cord. And those receptors are responsible for feeling of euphoria and relaxation that some patients experience after taking this medication. So what are the uses of oxycodone? As we know, we use oxycodone quite frequently in acute pain, pain after surgery, pain after injury, trauma, fracture of the hand, fracture of the ankle. It's a really good pain medication, and it's very strong, and it can be used for a short period of time. In certain instances, we use oxycodone for chronic pain. Patients who suffer from cancer, severe arthritis, patients who had multiple back surgery and they still have pain, and sometimes we use that medication. It also can use as a palliative medicine for patients who had very severe cancer that not responding to medication, and it can improve patients' quality of life. Oxycodone usually prescribed with other type of medication, including Tylenol or non-steroidal anti-inflammatory medication like Motrin or naproxen. The dosage of oxycodone depends on several factors. Patients, obviously, severity of the pain, location of the pain, and patient's previous experience with this type of medication. And the most important thing is we have to know what's the difference between oxycodone and Oxycontin. Basically, these are same medication, but Oxycontin is coated with a special layer that it will make Oxycontin an extended release. What does it mean? That means that if you take oxycodone, for example, it may work for only 4 to 6 hours. But if you take Oxycontin, it will last up to 12 hours. So we have immediate release oxycodone, or the formulation that patients can try for every 4 to 6 hours. And you have extended release or Oxycontin that will last up to 12 hours, and we can do it twice a day. Like any kind of medication, oxycodone has some side effect. The most common side effect is constipation. Opioid pain medications frequently cause constipation because it will slow down the bowel movement. And this constipation can be very severe. I usually tell my patients that they usually should use some laxative or stool softeners. Nausea and vomiting. These medications irritate the stomach and also have some central effect that can cause nausea and vomiting. Some patients also express some drowsiness and dizziness when they take it, especially older patients who may be very sensitive to this type of medication. So when you prescribe or when you see this medication with an older patients, you also have to be cautious that this medication could be making very drowsy and sleepy. In a very high dose, all of the opioid pain medication, including oxycodone, can cause some respiratory depression. That means that it will slow down the breathing, and it can be very life-threatening and dangerous. And you see it in an overdose of this medication. You can be allergic to this medication. Anybody can be allergic to oxycodone or morphine. And more than that, the concern about dependence and addiction is also a concern. A lot of patients who were started on this pain medication for surgical pains, they get hooked into this medication. That means that they have to take these meds more and more and more to get high out of it. It is very important to know some of the characteristics of this medication. One of the important characteristics is tolerance. And what is tolerance? Tolerance is a pharmacological phenomenon that after you take this medication for a while, your body sort of builds up some resistance to it and you become tolerant. For example, if you take a small dose of oxycodone over time and your body is more tolerant on it, then something happens and you need the surgery. You need to increase those medication to 10 milligram or 15 milligram. Obviously, physical dependence is also one of the characteristics that patients who take those medication for a while become dependent on it. And if they miss that medication, then they may go to the withdrawal symptoms that patients present with shaking and agitation and anxiety. And obviously addiction is the worst of all. Because of the euphoric effect of this oxycodone, unfortunately, some patients become addicted to oxycodone, and we all heard about it. We all know about it, how tragic it is. And if God forbid, someone took a lot of this medication, can be very dangerous because it can stop someone's breathing. And if that happens, it could be very, very dangerous. It could die from it, basically. So it's very important when you get this medication from your doctor, make sure there is enough medical supervision. This medication should be prescribed by your doctor. You should not take your friend's medication or get it from someone else. Number two, it's very important that you know about that medication. You should be educating yourself. You should contact your doctor, get more information about the medication side effect. And there is always those physicians that prescribe you oxycodone. There is a support system to explain to you if you have any side effect with this type of medication. We know how much risky is this medication that can cause constipation, addiction, dependence, tolerance, and all of these very unusual features. So when us as a pain physician or your physician is trying to manage your pain, we try to use a multimodal treatments. First, we try to use a non-opioid or non-narcotic medication, including Tylenol, non-steroidal anti-inflammatory medication like Motrin. We try non-pharmacological therapies like physical therapy, acupuncture, chiropractic treatments, and behavior therapy. And then other type of targeted treatments, the medication including gabapentin, Lyrica, and we mix it all together and see if we can minimize the use of oxycodone or at least use it for short term. Oxycodone is a very powerful and strong pain medication with lots of side effects, including constipation, nausea, risk of dependence and tolerance and addiction, and should be used basically only by very skilled physicians who are trained to manage this type of medication. It comes with the risk of addiction and dependence, so it's very important to have a conversation with your doctors when you are on this type of medication and try to avoid using long term of this medication. However, is a great pain medication after surgical procedures, but you and your physician should try other type of alternative treatments as well. Thank you for watching my video. I hope you've learned something today. This was really exciting for me today to come back in front of the camera, record another video for you all. I really miss you guys. Please send me your feedbacks and comments. Don't forget to subscribe to my channel. Make sure you watch Ask Your Pain Doc. We're looking forward to see you guys soon. Stay tuned and I will see you all soon.